So once we're done, you can disconnect this, and this is going to be tossed away because each time you section the patient, it's going to be completely sterile procedure. Okay? So this is thrown away. And then with those gloves, they're still clean, but they're not sterile anymore. You want to provide it here. So number one, you want to take the catheter, the inner catheter, out of the trach. Okay. Use two hands, not one hand. If you use one hand, you can pull the whole thing out. And there are sutures here, right? And then if you use two hands, but this hand, you need to be so gentle, like stabilize the plate without pressing. Because if you're pressing here, you have what? Those are two carotid arteries. You can occlude those two arteries and the patient will be dead. You cut off the blood supply. Okay, so gently stabilize the plate, take it out, and put it in here. Since your hands are dirty, so take this off. Okay, now we're ready to clean the catheter because the catheter is supposed to be sterile, and then you're going to down sterile gloves. Look, you are all ready. How do you clean them? Two ways. You can use this pipe cleaner, twist them all together, and bend it. So when you clean the tube, you do not trauma line. You do not just scratch the tubes because the scratch the tubes will collect more mucus, right? And then you can just go through it. Personally, I like to use this if I have to clean the trach tube.
And I will tell you that usually there's one section for
Okay, same thing. When you insert this, you want to be stabilizing the power. Okay, now the sterile part is over. The next thing you do is to clean this trach. And remember, this is the extra, what do you call that, extracurricular part of the body, right? So you really want to keep the dignity of the patient, and you want the patient to wear this as a necklace. So you want it to be clean all the time. Okay? So I'm going to do some sealing. For the purpose that you can see, I'm going to remove this. And you want to clean one side, this side, make sure and then you want to clean the top. Okay. If it's really dirty, you can also get some saline. Alright. And now you want to put a new dressing on. You see, this is a pre-cut dressing, and you can see this is folded very nicely. There's no lint. If there's no pre-cut dressing, you see, okay, this is a kit somehow that is missing. What do? You cannot cut a slit, because you cut it, what happens? There's a lint, and the lint is so close to the throat, then the patient can inhale it, okay? So what you do is you want to use your origami skills, maybe create something like this, okay, to dress the patient. So this way you don't have to cut anything, okay? But as we have anticipated, this is a good kit, and there's a dressing like this, and you want to put a dressing back onto the patient. And sometimes you don't want to cut this too much, and use the forceps to help you. Nice, new dressing. Then you want to change the...
Is that underneath the plate?
That's underneath the plate, correct. So you want to make this 1 inch longer? Not quite yet. Okay, there are many little tools that I can use. I can use this to help you. You do not want to take the old tape off until you have the new one. I'm not very good with this because I've seen students using that. I'm using my forceps. So at this point, you want to make one end is longer than the other. I think the top is longer. Then you want to actually the bottom should be longer.
Sorry, you have it.
It's a little bit easier on the real tissue because this is not going to be moving. Then you tie it. So how tight do you tie this? You want to make sure there are two fingers that can be placed under the tie, between the tie and the tissue comfortably. Okay, so you leave enough space there.
Can I just wear the same glove now? So there's
Then you take the old dressing off. This is trachea. That's it. All right. Any questions?